Hello, welcome back to my channel. Today let's chat about cervical screening. It's all about prevention. Today we are discussing cervical screening, often called a smear test. This is a simple check that can make a huge difference. It is for women and people with a cervix, usually between the ages of 25 and 64. Think of it as a proactive step, a way to stay ahead. It is not something to be scared of, but something to understand. Crucially, this test is not a test for cancer. Instead, cervical screening helps prevent cancer from developing. It looks for early changes in the cells of your cervix. These changes, if left untreated, could potentially turn into cancer. By finding these changes early, we can offer simple treatments. This stops cancer before it even has a chance to start. Regular screening means any tiny alterations in your cervical cells can be spotted. These alterations are often caused by something called HPV. The screening program in the UK is very effective. It saves thousands of lives every year. Attending your screening appointments, when invited, is one of the best things you can do for your long-term health. It's a few minutes that could make a lifetime of difference. Now let's talk about something called HPV. HPV stands for human papilloma virus. It is a very common virus. Most people, around 8 out of 10, will get HPV at some point in their lives. You can get HPV through close skin-to-skin contact, usually during sexual activity. Having HPV is not unusual. For most people, their body's immune system will clear the virus without them ever knowing they had it. There are many different types of HPV. Some types of HPV can cause things like warts on your hands or feet. Other types can affect the mouth, throat, or genital areas. The types of HPV that cervical screening looks for are called high-risk HPV. These are the types that can cause changes to the cells in the cervix. It is these high-risk types that are linked to the development of cervical cancer. Most HPV infections, even high-risk ones, do not cause any problems. Your immune system is usually very good at getting rid of the virus naturally. Knowing about HPV helps you understand why screening is so important. We have talked about HPV being very common. We also know that most HPV infections go away on their own. But what happens when a high-risk HPV infection doesn't go away? This is when it can start to cause problems for the cells in your cervix. The cervix is the lower part of your womb, often called the neck of the womb. It opens into the vagina. When high-risk HPV stays in the cervical cells for a long time, it can cause these cells to change. This process is usually very slow, often taking many years. These cell changes are not cancer. They are often called precancerous changes or abnormalities. This means that they are not cancer, but they could potentially turn into cancer if they are not treated. The medical terms for these changes can sound a bit scary, like dyskaryosis. But it is important to remember that finding these changes early is a good thing. It means we can do something about them long before they become serious. This is precisely why cervical screening is so valuable. It catches these changes at a very early, treatable stage. Thinking about the smear test itself can make some people feel a bit anxious. So let's walk through what actually happens during the appointment. Knowing what to expect can often help to ease any worries you might have. The test is usually carried out by a specially trained nurse or doctor. It takes place in a private room at your GP surgery or a local sexual health clinic. The whole appointment usually only takes about 10 to 15 minutes. The test itself is very quick, just a few minutes of that time. When you arrive, the nurse or doctor will explain the procedure to you. They will answer any questions you have. You will be asked to undress from the waist down. You will be given a paper sheet to cover yourself with. Then, you will lie on an examination couch, usually on your back, with your knees bent and your feet together. The nurse will help you find a comfortable position. The sample of cells is then sent to a laboratory for testing. Section 5. After your test, making sense of your smear test results. Once your smear test sample has been sent to the laboratory, you will need to wait for your results. This usually takes a few weeks, and you will receive them by post. Waiting for results can sometimes make people feel a bit anxious. But remember, most results come back as normal, meaning no high-risk HPV was found. If this is your result, it is great news. It means your risk of developing cervical cancer is very low. You will simply be invited back for screening again in 3 or 5 years, depending on your age. Sometimes, the result will show that high-risk HPV was found. If high-risk HPV is found, the laboratory will then look at the same sample for any changes in your cervical cells. If no cell changes are found, this is also good news. It means the HPV has not caused any harm to your cells at this time. You will usually be invited for another screening test in 1 year. This is just to check if your immune system has cleared the HPV. Most of the time, it will have. It is completely normal to have some worries or concerns about having a smear test. Many people feel a bit embarrassed or anxious about the procedure. Some worry that it might be painful. These are very common feelings, so please know you are not alone if you feel this way. Healthcare professionals who perform smear tests understand these concerns. They are trained to be sensitive and to help you feel as relaxed and comfortable as possible. Your dignity and comfort are their top priorities during the appointment. Let's talk about embarrassment. The thought of undressing from the waist down can make some people feel self-conscious. Remember, the nurse or doctor performs these tests very regularly. For them, it is a routine part of their job, just like taking a blood pressure reading. They are focused on your health and well-being. You will be given a paper sheet to cover yourself. You can also wear a skirt or a long top that you can lift up, rather than completely removing all your lower clothing. This might help you feel more covered. You may have heard about the HPV vaccine. This vaccine is a fantastic development in protecting against cervical cancer. In the UK, the HPV vaccine is offered to girls and boys aged 12 to 13 in secondary school. It helps protect against the main types of HPV that cause most cervical cancers. It also protects against some other HPV-related cancers and genital warts. The vaccine works best if it is given before someone becomes sexually active and exposed to HPV. It has been shown to be very effective in reducing HPV infections and precancerous cervical changes. The HPV vaccine is a major step forward in public health. It significantly reduces the risk of developing cervical cancer for those who are vaccinated. However, it is really important to understand that the vaccine does not protect against all types of HPV. There are some less common high-risk HPV types that can still cause cervical cancer, and which the vaccine doesn't cover. This means that even if you have had the HPV vaccine, you still need to attend your cervical screening appointments when you are invited. Screening provides that extra layer of protection. Think of it like this. The HPV vaccine is like wearing a very good seatbelt in a car. It offers excellent protection. Sometimes, when life is busy, it can be easy to put off health appointments. You might think, why bother with a smear test if I feel fine? This is a common thought. However, the amazing thing about cervical screening is its power to catch problems before you would even notice any symptoms. Early cell changes caused by HPV usually do not cause any symptoms at all. You would not know they are there. That is why screening is so important. It is looking for these silent changes. Catching these changes early is key. When cell changes are found at an early stage, they can be monitored or treated very easily and effectively. Treatment is often very simple, usually done in an outpatient clinic. It is highly successful at preventing cancer from developing. If you wait until you have symptoms of cervical cancer, such as unusual bleeding, the cancer may be more advanced. Treatment for cervical cancer is much more complex and has a bigger impact on your life than treatment for early cell changes. Early detection truly saves lives. Think about the statistics. We have covered a lot of information today about cervical screening, HPV, and why it is also important. The main message I want you to take away is that cervical screening is a vital tool for preventing cervical cancer. It is a test that looks for high-risk HPV and early cell changes, allowing for simple treatment if needed. This stops cancer before it even has a chance to start. It is a proactive step you can take to look after your body and your future health. Your well-being is so incredibly precious. Remember, the smear test procedure is quick. The healthcare professionals who do it are trained to make you feel as comfortable as possible. If you have any worries or concerns, please talk to them. They are there to help you. Whether it is concerns about pain, embarrassment, or previous experiences, they can support you. The HPV vaccine is a great help, but screening is still essential for everyone who is eligible, even if vaccinated. Early detection is what makes all the difference in preventing cervical cancer effectively. This is your health we are talking about. It is your life. If you enjoy this video, please don't forget to like, comment, share and subscribe for more health tips.